Good afternoon and welcome to another Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, also available on TV3 in Connorsville. We are, you're not him.
I'm not him. I'm not him. I'm told that daily.
You're told that daily. I can imagine that you are. Sitting in for Dr. David Jetmore, Christine Stinson, Executive Director, Wayne County Health Department. Glad to have you here with us.
Oh, I'm glad to be here. Thank you.
This is going to be a big one with all the things coming off this weekend and the changes. I think we ought to just give her the show.
A lot of exciting things going on.
A lot going on. Exciting is an interesting word. Dr. Thomas Huth, Vice President, Medical Affairs, Reid Health, as always, in the seat. Glad to have you here.
Thank you.
We have a guest on Zoom that will join in just a moment, Anne Houtman, who is the president of Earlham College. But as we do real quickly, let's start with what you learned new this week. What changed? Well, we'll get into a lot of what changed, but what's new for you this week?
Oh, you're starting with me?
I'll start with you.
Gosh, there's all the time new stuff. This week is probably not one big thing happening, but a number of things that I think are going to wind up being important. One is the start of the Johnson & Johnson phase 3 trial of their vaccine, which is important for a couple of reasons. One is that they are testing about twice the number of volunteer subjects than some of the other vaccine makers are. And I think that will help with people feeling that it's been adequately tested before it's marketed, assuming it becomes marketed and there aren't problems. But the other thing that's probably even more important about that particular vaccine is it's one shot, not two a month apart. And that's going to, really reduce the complexity of administration on health departments and other people that administer the shots. And I think will also help with acceptance in the community if I can just get one shot and be done with it. Another thing that I noticed this week is there was it was a research letter, but it was based on data from Iceland, published in the New England Journal of Medicine, that is kind of counter to the idea that we've been getting, that antibody levels wane within a few months after infection or vaccination. And basically they studied essentially the entire population of Iceland, everybody in Iceland who had COVID-19, and they tested them sequentially for antibodies 4 months out and stopped, and they never ran into a period where the antibody levels declined. There was an accompanying editorial that said, maybe the problem in the U.S. and Europe, where the antibody levels have been studied, has to do with not taking into account that there are actually a couple phases to immune response. There are early phase events that result in certain antibody levels rising and then falling, and then there are later phase events that result in more long-lasting antibodies. And maybe we're not testing the right antibodies at the right times, and that's why we're getting these discordant results. It's just one letter. It needs to be, sort of confirmed with additional research, but I think that would be exciting to find out that actually we can have and maintain good immune responses. Then you're going to think this is a small thing, but this should be of interest to you, Eric, since you're wearing glasses.
Okay.
There was an article published in the Journal of the American Medical Association from an analysis of cases, a cohort study. It's not just simply an observational study. It was actually a proactive cohort study in China looking at people who wear glasses versus those who don't wear glasses. And people who wear glasses got COVID-19 at a lower rate than those who don't wear glasses and had less severe illness when they did have it. So yes, Christine's putting on her glasses now.
But you have to wear them. They can't be on the table next to you.
And so, the idea there obviously is that maybe having some protection of the eyes helps with, the small droplets, whatever, that can be transmitted in close quarters. And it reminded me that the CDC, I think, still has on its website a recommendation that in communities that have more than minimal community spread of COVID-19, healthcare workers probably should wear protective eyewear in all their patient interactions, not just ones with COVID-19 patients, because they're likely to run into asymptomatic people in their normal course of the workday. So I just thought that was kind of interesting and fun study that was maybe a little bit off the beaten track, but could amount to something. We'll see if that bears out.
Interesting. We were talking last week about, and you mentioned the Johnson & Johnson being one shot. We were also talking last week, and I think Dr. Jetmore brought it up, as to the temperatures that some of the vaccines have to be kept at. I was watching, I think it was NBC Nightly News a couple of nights ago, and it's talking about a shortage of dry ice because there aren't a lot of people that do that here in the country, and trying to ship to the West Coast from the East Coast via truck dry ice in order to try to keep some of the vaccines low, and so just interesting little point out of here that came up later in the week.
Some of those sub-frozen ones, we wouldn't have the equipment to be able to maintain those vaccines, as most health departments don't have that equipment. So we were very, I mean, we definitely want to see a vaccine, but when we heard that it may be that sub-frozen vaccine, it kind of has put a little bit of panic in of how do we all, even the smaller health departments, be able to do this. We do have a meeting next week with Dr. Box to get our plans in place, which we all do. Our plans are all there. But I think we're going to be getting some more concrete timelines of when they're going to project to see this rolling out. We are all very excited about the Johnson & Johnson, the 1 dose. I think all of the other vaccines are the 2 dose. And so we know with all of our other vaccines, the 1-shot dose, you have far more compliance with to finish the regimen with it. So we're hopeful for the 1 vaccine, but we're hopeful for any vaccine as far as the local health department goes. I think that we're going to see it more toward the end of the year for some of our high-risk populations, and still more of a general vaccine for the general population, more to mid-2021.
Okay. And I was about to ask, with the Johnson & Johnson being 1 dose, they're just starting their phase 3 trials. It will actually probably take them a little bit longer to roll that one out, won't it?
That's
because
probably right.
There's already a couple in phase 3. They're just starting that point.
Yeah, with enrolling so many volunteer subjects, it's going to take them a while to do that. So I think that their product will probably come along later. I could be surprised about that, but we'll just have to see. I think we all kind of, we'd like something now or soon, but we'd rather have something good, even if that means a little bit later.
Okay.
I think that the things that we've seen over the past couple of weeks are that little glimmer of hope that there is light at the end of the tunnel, that we will see an end to this, and some of these restrictions and things like that, which leads to the big announcement that we had Wednesday from Governor Holcomb about Indiana going into stage 5. So there's a lot to digest with stage 5, and a lot of restrictions have been lifted with that, but some restrictions stay in place. The mandate for the masking and the social distancing are still in place. So while restaurants now can open at 100%, it's only at 100% if you can maintain the 6-foot separation. So that social distancing and physical separation of people will dictate how many people can be in any kind of event space, including restaurants and some of the festivals that are coming around. We're definitely happy to see festivals and events happening safely. But that does require all of us to wear masks, all of us to participate in that physical social distancing when we're in those events.
And I find that part of it interesting, because I was in a grocery store this morning that I was in 2 weeks ago. 2 weeks ago on the floor, there were these signs that said, please stay 6 feet apart. I went in this morning, there's no signs on the floor. So I'm thinking, okay, they're preparing for the lifting of restrictions, and nobody will be right on top of each other.
They're probably just putting new ones down.
Okay.
They probably just are replacing the older ones and fancying things up for the celebration that we're moving into stage 5. But we need to remember, and it'll kind of go into, I think I'm stepping over some
You're okay.
things.
You're doing fine.
But so Wayne County, we had a big bump a couple of weeks ago and saw our numbers steeply increase and bumped us into a high risk level, in the county metrics. And a lot of phone calls were made, emails were made because we have good plans. It was just a reminder to the schools, to facilities, to look at our plans and put them in place. Are we requiring masks when we're at different events, sporting events and things like that? Those are the best thing that we can do. And when we pull our plans out, we just need to implement the plans. We have them, read them, and make sure they're being implemented at volleyball games, at football games, at all of these events, because screaming and yelling is something that is a very good mode of transmission for the COVID-19. So keep the mask on when we're at these events, and we saw our numbers then come back down. And right now, Wayne County is looking very nice. We're back down in the county metric of a 0.5, coming off of a 1.5. So we're in the low level of transmission. We've had very few cases this week. I think the total case count for this week is 22. But I might be counting different than Dr. Huth counts.
Nope, that's what I got.
I count all cases, which include clinical cases. And on his, I believe it's only the laboratory confirmed cases. But so we're looking really, really good. And I want us to stay there. I want us to go into stage 5 and keep our community transmission low. We want to look at some of our directives for indoor visitations on long-term care facilities and relax those a little bit, but we want to do it safely, and we want to keep our community transmission low so the people in long-term care facilities can have visitations with their loved ones indoors. Right now they can have them outside, but as the weather gets cold, we want to continue with them allowing the visits. In a safe way, and the best way we can do that is to keep our community transmission low, and the best way to keep our community transmission low is for everyone to wear masks and to participate in that physical social distancing.
All right. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and also streaming on Facebook. We are joined on Zoom by Anne Houtman, who is president of Earlham College. We've talked about schools for a number of months on this show. So, Anne, thank you very much for joining us today. We're having a little audio. Okay, we're good? Nope, I think we're good.
Oh, good.
Okay, there you go. Thank you. Appreciate you holding on like that.
No problem.
You are in an interesting position. We've got a number of colleges and schools here in Wayne County. You're in an interesting position because you have a fairly large number, I think, of residential students coming in not only from other states, but even from other countries. Talk a little bit about how you all decided to do your classes and bring people back to class to start with. And then we'll talk about kind of how you've been going through this semester.
Sure, absolutely. So we're a residential liberal arts college. We've been doing that since 1847 right here in Richmond, Indiana. And this is the first time we had to send students home. And that was hard on our students, I'll just say that. We're nationally recognized for our student experience. We're committed to undergraduate teaching. Our students made it clear that they wanted to come back as soon as they could. With precautions in place. So we had to find a way forward with the appropriate guardrails in place. But honestly, the county and the city have been fantastic to work with, and how well controlled COVID's been here made our lives easier in deciding that. But I also said early, and when I talked to Dr. Jetmore and the head Reid and stuff, I don't want Earlham to be the reason that Richmond and Wayne County run into trouble. So you mentioned that our kids are from all over the United States and the world, and certainly that was a challenge for us to get them back safely, and we use testing and so forth to do that. The reason we wanted them here rather than at home is that many of them are in more rural areas or areas without good Wi-Fi. Sometimes they're sharing a bedroom with several siblings or other people. And so they really needed to be here to have the technology and the support, the resources to be successful. So that's how we made that decision. You kind of keep going every minute and think, I hope nothing bad happens, but so far so good.
What changes have you all had to make once you got everybody back on campus? I know Earlham is a campus that opens itself up to the community, invites the community out for speakers, for convocations, concerts, things of that nature. Talk about what changes you've had to make in your relationship with the community.
Yeah, that's a great point. Thank you, Eric. That was really hard. So I'm a new president. I've only been president for like 15 months or something. It's quite different than I was expecting. And one of my priorities was to make sure that our roots in Richmond, that was something that we celebrated and emphasized. And we have made the very difficult decision to close the campus to outside visitors until things are more under control and possibly until a vaccine's available. So that includes the Athletics and Wellness Center, which I've gotten an earful about that, as you can imagine, and also the library. The only people that come on when parents will bring their kids on campus, and then they'll leave again.
Your conference, I believe, made the decision that you would not be holding sports programs this year. Is that correct? And how has that gone over for some of your students?
That is, in fact, what our athletic conference decided. And, we decided to close on March 13th, and that was ahead of our athletic conference. And that was quite challenging. So when we reopened, we really wanted to work with our conference, and with really the conference had to hear from NCAA, and then we're Division III. So from Division III, what they were needed. Those recommendations changed a couple of times. It was very challenging for our student athletes. I felt bad for them. But they also have said explicitly they don't want to be the reason Earlham closes, so they're very committed to being very safe as they're working together, but as they're working out. But we are not having competitions until at least January.
Hi, Anne. This is Dr. Huth. We haven't had the pleasure of meeting face-to-face, but I'm glad to meet you here virtually.
Very nice to meet you.
As you describe the structure that you've put into place, I'm drawing a comparison to, say, what the NBA has done, kind of created a bubble within which all activities are taking place, and there's minimization of the transfer of people and, from the outside to inside the bubble. I don't know if you think about it that way, but that's just the image that kind of popped into my mind. But I wanted to ask about testing within that. How are you handling testing? Are you doing testing? Have you done? Are there plans for more testing for the students or the staff, or how are you handling that?
Oh, yeah, great question. And I will say, of course, that as student athletes, we can't bubble them because they need to go to their classes and they have friends who aren't athletes, and they have all the other elements of their education that they're doing right now. So although I will say some colleges chose to put their athletes in different dormitories, we felt that kind of went against the whole idea of how we operate here at Earlham. So we did not do that. And the students were also very clear that they wanted the roommates that they committed to last year, and so did not want to be moved around. That in terms of testing, we required everyone to be tested before they arrived on campus. That was at the beginning of August, and all employees were tested. And then again 2 weeks later, just in case anything had happened. And then we are getting ready to test again in, I believe, a week. The athletes, though, because they are in closer contact, half of the athletes are tested every week, and then trade off which half it is.
Okay. And I know that you, at Earlham, you've sort of traditionally had a fair number of international students. I'm just wondering if there have been any challenges with getting them onto campus, or because I can imagine a couple different scenarios where that might be challenging. Has that been an issue for you?
It really was getting them here. It was a real worry for us because, of course, a lot of national borders have closed. So we're a quarter international student, and I should be clear that we're not we don't use international students as a piggy bank, like some people think that's what colleges do. Ours receive the same amount of aid as all of our students. We see them as just a really important part of our community. So we do have students who were unable to cross the border. Our faculty are doing this amazing job of holding in-class classes, in-person classes, and then we've got technology so that those kids, some in very different time zones, are joining in the class and being involved in the discussion.
And when you think about, when I think about Earlham College, I think about its community engagement. The Bonner Scholars, all of the experiential learning that you do. Can you talk about how your students are handling that and going through that this year, and what changes did you make in some of those programs where students were needing to go out into the community to be, to grow, to learn?
Well, Eric, you're bringing up all the rough stuff here. So we moved to purely virtual internships for the fall and likely the spring as well. So our students are still engaging with the community, but virtually as much as possible. That's just to keep everybody safe, including Richmond and Wayne County.
Christine?
Hello, Anne. I also haven't met you yet, but glad to meet you via the internet. I just wanted to thank you for your students reaching out to the health department. I believe it was one of your health science classes have a project, and they specifically wanted to address the misinformation that's getting out surrounding COVID. So I've had some good conversations with a lot of your students, and what a lovely group of students you guys have.
Yeah, I'm very fond of them myself, and I'm so glad that that's working well. They do have a really strong sense of mission. The thing that's, I think, striking about Earlham students more than any other group I've met, and I would say not just Earlham students, but Earlham alumni, is that they're not only just super smart, but they're also really committed to making the world a better place. So I think you got a little flavor of that. I just love it.
And we appreciate you taking some time and talking to us today. Talk to us real briefly before you go. What is your semester like? Most of the colleges have made some transition to a shortened semester, maybe getting to the Thanksgiving break and then releasing the students, not having them come back until February, even though the semester may begin in January. Talk about what your class schedule is like for the rest of this year.
Sure. Well, you just described what we did. So we moved we moved up. We started a week earlier, and then we broke our 14-week semester into 2 7-week terms, where students only took 2 classes at a time. Faculty only taught 1 class at a time. That meant that they were spending time with half the number of students and faculty that they ordinarily would be. So we felt really good about that. And the other thing is that if we had to pivot to online, they only had 2 classes to work on online. That was really challenging in the spring when some of them would have 4 or 5 classes, and all classes moved to 4 units, so that because 2 was the maximum. And then the faculty would only have to pivot to 1 course online. So that's worked really well. We will be, this is the end of our first, we're calling it a mini-mester. So we made it through. So that's fantastic. And with very few, I think we've contact traced just 10 cases in total over the 8 weeks people have been on campus. And then we'll have, next week will be finals, and then we'll start our 7-week next 7-week term. They will go home the week of Thanksgiving and not come back until the very end of January. The spring semester starts February 1st.
Still, at this moment, planning to have a graduation the way graduations are known, or is that still kind of up in the air right now?
I really don't know right now. I felt so bad for the students not to have a real graduation, although I don't know if you saw, they did a beautiful job really quickly pulling together a faux graduation right before they left
Yeah.
in the spring, but we'll have to see what we can do. We're really, I just don't want to put anyone at risk, but I would love for them to have an in-person graduation. So excited to hear how the vaccines are going, fingers crossed. But I mean, it sounds reasonable to me that we could have a graduation at the end of May or June.
Okay. Anne Houtman, president of Earlham College. We appreciate you taking the time and talking with us today. Hopefully we can check in with you again.
Absolutely, anytime. Very great to meet you all.
Nice meeting you. Thank you. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We are taking your questions on our Facebook page as well as on Twitter at WCTV Info. Dr. Thomas Huth, Vice President, Medical Affairs, Reid Health, in his place as always, sitting in for Dr. David Jetmore. He's off on his bike. He found a Good Friday.
Yeah.
He went, it's going to get cold soon. He fired up the bike and took a drive, didn't he?
I hope he is enjoying himself. He deserves it.
Christine Stinson, Executive Director of the Wayne County Health Department, sitting in his place. Let's see if we've got a couple of questions to get in, and then we'll talk about the removal of some of the restrictions, what's changed, what's not changed, and what people need to know, particularly heading into this weekend. So if we've got a question, as we inch closer to flu season, I think we're doing much more than inching, aren't we? Is there any information about how both COVID-19 and the flu will affect each other for a person who may have both?
Well, we have actually had a couple of flu cases in the community. I haven't seen recent numbers, so I don't know how many. I can't name a number, but I know that we've had one case where the individual tested positive for flu and COVID-19 at the same time. Mm-hmm. And I would say our expectation is that if you have symptomatic COVID-19 and symptomatic influenza, you're going to be sicker than you would be with either one alone. But I think the jury's out right now on just how much sicker, how much likelier you are to wind up in the hospital or on a ventilator. I don't think we know very much right now because we don't have a lot of experience with that. What I can tell you is that in looking at the experience of the Southern Hemisphere for their winter that recently ended, they actually, a lot of the Southern Hemisphere countries have had really better compliance rates than we've been able to achieve, I think, in the U.S. and in places when it comes to hygiene, distancing, masking. And they have also had lower rates of influenza compared to a normal year for them. So, you know, it's a little bit hard to know what that means exactly. It could be they just had a mild flu season, but we think that it's because of all the precautions that are being taken related to COVID-19. It's actually helped them reduce the severity of their influenza season. That's true both in South America, Australia, and Southern Africa. So I'm hopeful that if everybody stays on their game, that we'll have the same experience here.
That
But
would be nice.
there are a lot of ifs in there, and then you throw in, how high can we get the influenza vaccination rates, and when we have a COVID-19 vaccine, how high can we get the vaccination rates on that? I think all that will make a huge difference.
That is just a little peek here. I can't show everyone because it's hot off the presses. We are encouraging everyone to get a flu shot this year. We could have debates on should I take the flu shot or not. This year, go ahead and take a flu vaccine shot this year. You can get them a lot of different places. The health department's certainly not the only place, and we know we are not going to be able to get everybody, but we will be holding our first flu clinic. Don't zoom in on it because that might change. But tentatively, it's definitely going to be on Saturday. I'm just trying to nail down how and what's the best location to have it.
Not this Saturday, but
not
Yeah, I'm
tomorrow,
sorry.
Saturday
Yeah.
next.
See, I knew I
Yeah.
would mess it up. I knew trying to sneak it out there. So October 3rd.
I just didn't want to create I didn't want you to create problems for yourself. If people call and say, where are these flu shots
where
I
are
can
we?
get tomorrow?
That's the name of the game for me. It causes as much problems for myself as I possibly can. So next Saturday, October 3rd, will be the county's first flu clinic. And then we are planning a clinic at every school district. not at every school building, but we're working with the superintendents, and it's not just for the students, it's for the community. And I thought
Wow.
the best way to bring it to the communities would be to bring it to one of their schools. So the superintendents and the principals are working on their plan of what building they want me to bring it to, and we will hold one in every single district of the schools. So those will be those events. For every school district, we have the high-dose flu vaccine. If you have insurance, we cover most insurances, so I wouldn't be concerned about that. And if you don't have insurance, don't let that be a factor to getting a flu shot. You can always come to the health department to do that. The state is working on getting flu vaccines to some big pharmacies, so everyone will have an opportunity to get them, but we will start holding ours next Saturday, October 3rd.
Okay. Keep watch on our social media sites as well as the county social media sites. We'll keep you updated on that as soon as we get more information. Let's go to another question. Are people still being diagnosed with COVID-19 based on presumptive clinical symptoms and signs even if they test negative?
I believe the answer to that question is yes, they can be. But I think that we have maybe fewer clinical cases than we used to do because we now have the more ability to get everybody tested. And I've been working with our providers at Reid anyway to try to limit what we're calling clinical COVID, despite a negative test, to really being a little bit more clear on what factors we're going to take into account and what criteria we're going to use so that everybody with a sniffle doesn't get called clinical COVID. And because
I don't think it was ever, and
That
that
was an
got out there
exaggeration.
that people were like, anyone has a sniffle, they're getting, they're trying to run up
That's an
numbers.
exaggeration. It was never
That
quite
is
like
not
that.
true at all.
But still, I think, in terms of, we've been trying to coordinate
Yeah.
more closely with the health department so that we can be saying the same things, be using the same criteria, minimize the workload on each other
Right.
when it comes to managing these cases. But I think, what we're trying to do is get ready for when we do have a lot more cough and cold flu season happening.
Right.
We have some now, but there will be more, so we want to make sure we're well coordinated. Bottom line is, it is possible still to be diagnosed with, as a clinical COVID case, if you have a more classic syndrome, especially if there is disturbance of smell and taste involved. And and despite a negative test, because we have to remember that it is possible to have a false negative test, because it depends on where in the course of illness you get tested in the terms of time frame, and even in the best scenario, there will still be an occasional case missed. So it takes a lot of judgment to apply this, but I think we're doing better with it.
We never had a more clinical cases than laboratory cases. We've always had more laboratory confirmed cases than clinical cases. And as we've moved on, like Dr. Huth said, we've found out a better way to be able to ferret out and make sure that we're just calling the ones that we're sure is COVID. And like he said, it's the ones that if you lose your taste and smell, even if your test comes back negative, it's COVID, and so they call it COVID. But I think this week we've only had 2 clinical cases, and so then the rest of those, the 19, are laboratory.
Okay. We're going to get to 1 or 2 more questions real quick, then we'll talk about testing and where, because that's one of those things that has also altered here in this past week or so. So let's see if we've got 1 or 2 more questions we can get in. With so many disposable masks given out in Wayne County, can you show how they should be removed from the face safely? Are they to be used only once and then thrown away, or can they be reused?
Those are good questions. Do you want to take
Well,
that, Dr. Huth, since you're a doctor?
I think it depends a little bit on the situation. In the hospital, we're a lot more careful about how we're, donning and doffing is what the usual term that is applied, all PPE and including masks, and how often we're using them and how long we're using them. I mean, there are some situations where we can continue to use them as long as they're clean and we're minimizing the touching and so forth. But in terms of demonstrating you want to do the demo there,
Sure.
Christine?
And when we give out the disposable mask, we talk about they're usually rated for about 8 hours to wear. So if someone is just wearing them for 20 minutes at a time, they can wear that mask a couple of days, unless it becomes visibly soiled.
Yeah.
And so when you put your mask on, if it smells like your lunch, go ahead and properly dispose of it and get a new mask. We have, if you ever need another box of masks, you can come to the health department and get one. So it's important when you're dealing with your mask that you're not touching, where, you're breathing into. So you're handling it by its loops.
Right.
And so when you put it on, you put it as close to how it's going to be worn as possible, and then fit it over your ears. It should be under your chin and over your nose at all times when you're wearing this. It does no good to wear it like this. And I see this all the time.
Yeah, I've seen that a lot.
And I see this all the time. This is not doing any good. It needs to be fitted over the nose and the chin at the same time. Have a tight fit across the bridge of your mouth, or the bridge of under your eyes and across your nose. So when you want to take it off, again, we don't want to be playing with this area of your mask. And I see this a lot too. People are all the time fitting it and fiddling with it. That should not happen. After you fiddle with your mask, you need to wash your hands. But when you remove your mask, you grab it by the ear loops and take it off like this. Never again touching where you're breathing into. I recommend on these reusable masks that they're washed daily. So I wash my masks daily. I have several masks. I just got this one today, so I can put that in my rotation. But I wash my mask every day at home. I come home, I wash it on the delicate cycle, and then I lay my mask out to dry. I don't put them in the dryer to dry them.
I guess I would like to just make the point that when we're in healthcare settings, we're a lot more rigorous
Right.
about, some standards on how long and under what circumstances a medical mask can be used and when they should be changed and so forth. I think we don't have to be so rigorous about that out in the community. I've got masks that a rotation of masks that I'm using repeatedly and sanitizing and so forth, and I'm trying not to touch it so much, but it's kind of hard to never touch it, and trying just to be aware that, sanitize my hands frequently and so forth. The key thing is to cover the mouth and the nose. If you can't get anything else right, just do cover the mouth and nose. And don't get too fixated on the proper use. Just keep a couple of simple rules in mind and you'll be fine.
Okay. Steve Bonwig directing today, getting some help from Michelle Thompson. Let's get another question in before we move to where you can get a COVID test. Can aerosol disinfectants be used to disinfect cloth face coverings, or can you explain the proper way to disinfect cloth masks for reuse? You just mentioned washing daily, but
yeah, I think washing them is the way, really. But I guess I see the attractiveness to using a spray disinfectant, but I just don't have any information that that's adequate or not. So I don't know whether to say that's good. I don't want to act like it's okay. It might be. Somebody needs to study it. Maybe we should run that study.
Yeah, I don't know that I would. Personally, I wouldn't do that. Only because I wouldn't want to then have that disinfectant so close to my face.
Yeah, maybe.
To breathe in afterwards. I think the proper way to do it is to wash them daily, and if it's a disposable mask and it's become soiled, properly dispose of it by putting it in the trash, and just get a fresh mask. I don't think that we're so short supplied on PPE that we need to be spraying our mask with disinfectant.
Right.
And if anyone needs a box of masks, you can always come to the health department. There'll be some other sites throughout the community that we're going to stage masks at different places where we're getting away from the event of passing them out and getting to a maintenance program where this is just part of our daily lives now. We have to have masks.
will you have them at your testing site in the Elder Beerman building?
We always have masks at the testing site. I don't want people to go to the testing site to pick things up. That's really, we just want people to go and get tested and leave. So they can always go to the health department and pick up a mask. We're just a few steps away from the old Elder Beerman building.
Have you started your testing
We
in
have.
the Elderberman building? And
have.
has the Optum site now moved to Cambridge City?
We've secured a location finally in Cambridge City. I was getting really nervous that I wasn't going to be able to secure a site for this, and so we've secured a location thanks to Sugar Creek Packing. They have donated the site for the new Optum Serve testing site to be moved to Cambridge City. So for a couple of weeks, both sites were operating in the same building, and that was great because that gave us a little bit of room to breathe to get our staff up and going and work through our hiccups with registrations and things like that. So our site is up and going. Optum Serve is still there until 4 o'clock today, and at 4 o'clock we are packing them up and moving them to the Cambridge City site. So they will be up testing at 8 o'clock in the morning Monday at it's 138 West Main Street in Cambridge City. So it's at the corner of 40 and Green Street. Used to be a bank, and then most recently I think it was a insurance company. But there'll be plenty of signs out there that you won't be able to miss it. It's a great site. I wish that I was there. Beautiful windows, so they'll be able to see out. And so Monday morning at 8 o'clock, they'll be in Cambridge City. And we were really focused on trying to get something to the west side of the community because in Richmond, we've got the county testing site, Reid Respiratory Clinic, First Care, Meridian Health Services, and CVS. All are able to test. CVS on Chester Boulevard. All are doing COVID testing. So there's no reason for someone to say, I don't know where to go get tested in Richmond. But when you look anywhere else in the county, there was nowhere else for people to get tested. So we wanted to move something out to the west side of the community so people didn't have to come all the way in. Wayne County is a little unique to other counties. Our county seat is not in the center of the county. It's very far to the east side of the county. So if you live outside on the west side, it can take you 30, 35 minutes to get to Richmond. So putting it in Cambridge City is a great location for it, and I can't thank Sugar Creek Packing enough for donating that space. They want to have, helping the community have testing. So they donated that space for the Optum Serve to have that testing site.
Okay. Let's see if we can get a couple more questions in, then we'll get to some numbers with Dr. Huth here. With Level 5 back on track being enacted tomorrow in Indiana, how does this affect churches? Are they required to wear masks and social distance when they meet for church services inside their buildings?
Yes.
You're nodding your head.
Absolutely, emphatically. I don't know how to do it more than I am. Yes, 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 yes. You have to wear a mask. Yes, you have to still participate in the physical social distancing of 6 feet. Churches and any place can now congregate up to 500 people without having a plan approved by the health department. But again, your location and your physical facility will dictate how many people you can bring together because we still have to have that 6 foot separation. Now, in a family unit, I'll take my family as an example. Me, my husband, and my son live together. We could go to church and sit together as a unit because we already are exposed to each other. And then when Dr. Huth and his wife come in, they have to be 6 feet away from us because they don't live in our household. So that kind of spacing dictates how many people can be brought into your church. But masks definitely are still part of the Stage 5 reopening of Indiana. It's still in the mandate, and still the physical social distancing is.
Okay. Let's get another one in. I've been hearing a lot about the importance of contact tracing. What happens if someone is not cooperative with the contact tracing process? And a hush falls over the crowd.
Deep sighs and disappointment happens. We get notified all the time that people are not cooperating with this. We will make a visit to people and go over again those guidelines. We do not want to take it to the level of court action. Indiana IC codes do give that authority to a health officer to implement some of those things. it's nowhere that we want to go down. So we try again through education and the importance of what contact tracing and quarantine and isolation does for our community, and we try to gain compliance with that. But we've made several visits to homes to go over it in person with people. But they get a phone call, they get letters, and then if we get notified that they're not cooperating, we'll make another phone call. If we can't gain compliance with that, we do make a visit to the house.
Okay. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming live on Facebook. We always check the latest numbers from Reid Health with Dr. Huth, so let's get that in. We've probably got about 12 minutes or so left in the show.
Okay. I certainly don't need that much time, but when Stephen and can bring it up. Okay, these are the Reid average daily inpatient numbers, and I should say they're the average for a given week. So in the week ended, the week that will end tomorrow, we have about 21 patients in isolation areas on any given day, 6 known positives, and 2 on ventilators. That's pretty much exactly what we had this morning. And really the important thing is that you can see that in the cases of the isolation patients and the known positives, the bars are a little bit below the moving average line, which means that we're trending down. And so that's certainly a pattern we'd like to see continued. I'd love to see the ventilator patients go away, because those, to decline and go away, because, those are people who are really suffering, and we don't like that. So it'd be great to see those go away. But they're kind of hanging in there, which is a little bit frustrating, as even though the other numbers are declining. But we've had decline, so that's good.
That number of 2, it just probably stupid question, but that number of 2 that's not the same patients that you've had on ventilators for the last 4 weeks or so.
You're right.
You've been able to move people on and off of those.
Correct.
Because we have heard of people going on a ventilator and staying there for an extended period of time.
That can happen. We typically, I'd have to go research it and kind of find out how long on average, when a patient at Reid goes on a ventilator, how long they stay on the ventilator. So I can't answer that question right now, but I can tell you that, today's 2 may be the same ones from yesterday, but if you say to go over the whole week, it probably is. Somebody came off, somebody else went on, and so we do have quite a bit of going off, coming on over time.
Christine, talk to us a little bit about what does happen with the release of some of the restrictions tomorrow. We've already gotten a few questions.
Yeah.
What happens in churches, what happens here, what happens there. Talk about moving to stage 5. What actually is happening, what isn't happening?
Right. So the one thing that I was glad that Governor Holcomb kept in there was the masking mandate and the physical social distancing mandate. But restaurants now are open at 100%. Bars and taverns are open at 100%. However, we still have to be 6 feet apart. So that you may have a capacity limit of 250 people, but if that means that you can't have the physical separation of your guests, you can't have 250 people in there. So that's one of the big thing. Everyone's happy about that. But I have to keep reminding them there's still this component of it. Your tables still have to be 6 feet apart, so that may limit how many people can come back in. The masks are still required in restaurants unless you're sitting down and eating. So when you walk into the restaurant and you're going to your table, your mask has to be on. Hairdressers can now have people come into a waiting room. That's something that's new. That hadn't been before, so they can have the doors open and have people in a waiting room, again, with the distancing and things like that. The gatherings now are up to 500. You can have more in an event, but you have to have a plan approved by the health department if you're going to have over 500 people. But it's still, the requirement of masking is still in that. So even if you're having an event that has 25 people, it's still the event organizer's responsibility to have people wearing masks and promoting the physical social distancing of people.
Let's see if we can get a couple questions in before we run out of time on this Friday afternoon. Can you explain what recovered from COVID actually means? I know people who are considered recovered, but they still are experiencing problems which they did not have before contracting the virus.
Well, that's a good question. It can be hard to put an exact endpoint on it. I think it depends on a little bit on how you're defining it. If you mean when are they safe to go back into the community, that is a little bit more defined. Generally, it's 10 days after the start of either symptoms or when they tested positive, whichever came first. And in some cases longer than that, but probably typically gets 10 to 14 days, and then you're good to go back into the community. That doesn't mean you're symptom-free, though, because there can be a number of sort of hanger-on type symptoms. Probably the biggest one I hear about is just kind of an overwhelming fatigue that continues on, but occasionally people have still some cough. We don't like people who still have fever to go back into the community. That's another criterion for safely kind of re-emerging. But there are some longer-term effects that we're beginning to kind of become aware of and concerned about. One is the multisystem inflammatory syndrome in children, which tends to happen many weeks after they've had an acute COVID-19 illness. Don't know very much about this problem in children. It appears to be very rare, but everybody thinks it's a real thing, but it needs more study. Another issue that's of interest, particularly in younger folks, particularly athletes, is whether or not there could be a prolonged so-called myocarditis, but that was basically inflammation of the tissues of the heart that may follow on a COVID-19 infection. And so the American Academy of Pediatrics and some of the health authorities related to college sports and professional sports are now recommend that athletes who are participating, who have COVID-19, actually have a longer period not participating in sports even after they've fully recovered from their symptoms, to allow that myocarditis to fully resolve. And depending on the severity of the acute COVID-19 illness, they're now being recommended to have particular studies of the heart to ensure that the structure and function is normal. There's no evidence of continuing inflammation. So that is a long-winded way of saying I'm not exactly sure how you define recovery.
Yeah.
It all depends on the situation and exactly what you're concerned about. And I think it probably makes sense if you're an athlete to not go back to rigorous activity too soon. And, probably a minimum of 2 weeks after full symptomatic recovery is what most of the authorities are recommending.
Okay. We've got 4 minutes left. We're going to try to sneak one more in here. Early in the pandemic, I heard that, what is that?
Yeah, and NSAIDs. This sounds like a medical person who wrote this question.
Yeah.
Non-steroidal anti-inflammatory drugs.
Okay, those could possibly make COVID-19 symptoms worse and may play a role in complications from the virus. Is that still believed to be true?
I haven't heard talk about the NSAIDs recently, but I think it's probably still true that we're avoiding the non-steroidal and non-steroidals in active COVID-19 infection and recommending people to not use those, because there was some evidence early on that people had poorer outcomes when they had been on or were given non-steroidals. And the non-steroidals are things like aspirin, ibuprofen, and related arthritic type of drugs. Now, if you have an arthritis problem and you need the non-steroidal, that might be different. But I think it is still commonly recommended that people who are recovering from COVID-19 avoid the non-steroidals for a period of time afterwards.
And you see why I'm just kind of sitting in this chair and letting them answer the questions. I can't even read most of them. 30 seconds. Anything you want to wrap this up with?
Well, I could mention two things real quick. We didn't look at the Wayne County numbers. I don't know if you could still show those, Stephen. but Christine might want to comment on this when it comes to hers, so be ready with that. I also want to emphasize with the flu shots that not only do we want people to get them, but we want them to get them soon. I think it's better this year to get it early, so just to make sure you get it, and also allow time to build up antibodies to the flu, so that we think that if COVID makes a resurgence in the community, people will be better protected. So I'm personally getting my flu shot on Monday. You probably can get them at CVS. I'm not exactly sure who's making them available right now, but we are making them available in our clinics.
Okay.
I got my flu shot yesterday, and it's a little tender, but other than that, it's good. You can make an appointment at the health department to get your flu shot, and we recommend exactly what Dr. Huth said, that go ahead and get it early. Don't wait until we start seeing a lot of it flying around the community, because we have already seen flu in the community. So getting it anytime, call the health department, call your doctor, go to CVS or any of the pharmacies are getting them. And we look for us bringing out the clinics to the community. We will be having one in Richmond on October the 3rd. But if you do put those numbers back up for Wayne County, I couldn't be more proud of how our community responded when we started showing that we were having that tremendous peak. And if you look, some of the other counties that have had big peaks, their peak lasts for a very long time. We responded very, very quickly to it, and you can see it has came way back down. So I'm very proud of how we're doing, and I hope we continue to have low numbers as we continue into phase 5 or stage 5 reopening. I hope everyone enjoys the fall events and everything, but wears a mask and practices the social physical distancing and wash your hands often.
Okay. Sitting in for Dr. Jetmore, Christine Stinson, Wayne County Executive Director of the Wayne County Health Department. Sitting in for himself, Dr. Thomas Huth, Vice President of Medical Affairs for Reid Health.
My pleasure.
And also Wednesday evenings, 5 p.m. You can find him on WHIO-TV. COVID testing, I will let you know, is available a couple of different places. The old Elder Bierman site is still up. That's being run by the Wayne County Health Department. And beginning Monday at 8 a.m., you can do it in Cambridge City, 138 West Main Street in Cambridge City. That's open Monday through Friday from 8 a.m. to 8 p.m. We'll be back again next Friday for another edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Get out and enjoy this weekend. Do please wear your mask. And as always, I wish you well. Have a great weekend. Stay safe.